Hello, my name's James Titcombe and I'm the National Patient Safety Advisor for CQC, and I'm really pleased today to be answering some of your Twitter questions. Yeah, absolutely. So the whistleblowing event recently was a really good start and enabled us to really understand some of the stories that people have had, and some of them are quite shocking. We're doing a lot of work with complaints as well. We're working with the Patients Association. It's so important that organisations respond and learn from the complaints it gets, and we've got a big role to play, and we've got to get that right. So absolutely, in the future we will be having a listening event to talk to complainants about the work we're doing and to get their views on the direction we're going in. So, really good question. I don't really consider myself to be a whistleblower at all, to be honest. I'm a dad who had a tragic incident in the NHS, and I've responded to it. So that doesn't really make me a whistleblower. I've got more respect, I think, for professionals who have raised concerns. So the question, I think, is also making a point that where does the information that historical whistleblowers fit in with CQC? And it's really important to say that we do need to listen to people's historical experience. It's about the culture of the organisation, how they were treated, and we need to know that an organisation's treating people properly. So we do need to listen, and we do need to learn from that experience. In terms of what we do in our inspections at the moment, obviously the focus has got to be on current standards of care. So if something happened 5-6 years ago, that isn't going to be as relevant to us in terms of our inspection, but we do need to know about historical whistleblowers, we do need to listen, and we do need to make sure that the culture changes in those organisations. So I think the Don Berwick report talked of, more than anything else, the NHS needs to become an organisation of continuous learning. And I think if we look back at what Francis said, a lot of his findings were about the lack of candour, about defensive cultures, a cover-up culture. That's really what we've got to change. And to get that right, you've got to have the right kind of culture, you've got to have good leadership, you've got to have staff who feel able to talk about things that have gone wrong. You've got to have an open reporting culture. So to get that right, it's got to take leadership, it's got to take this idea of a blame culture, it's got to change. We've got to have people safely able to report things that have gone wrong, and for learning to be the number one response to incidents, not defensiveness, not covering up. And that's really where we've got to go. He did describe that culture, and I think we've all seen examples of frontline staff who seem to take the brunt of blame when things go wrong, whereas perhaps people in management positions seem to go off to other jobs and with payoffs and that kind of thing. We've got to avoid that. So one of the government recommendations is that CQC take on this remit of a fit and proper person test, and I think that's going to be a huge step forward. So to look at the leaders in healthcare, what are the characteristics that we want to see in good leadership? Do the people that are in these positions have those characteristics? And if we apply that test, I think that's going to be a really meaningful step towards getting that right. Another really good question. When looking at how well a service provides care, I think it's really important that you're not just doing that for one group of people, and actually you're looking at everybody, and that includes vulnerable groups, including people who are deaf. So one of the things we do is with the listening events we hold, we can arrange for translators to be available, and also in the way we inspect hospitals, we've got to look at vulnerable groups of people to see what provision is made to ensure that they are getting the care that they need. So we do specifically look at groups of people, including deaf people, during our inspection process to make sure that the providers are doing a good job in ensuring that they have access to the right requirements. Great question, and that kind of real-time feedback from people's experience, and not necessarily a complaint, but actually how was the service, how was the care they were given, is so valuable, I think. So there are a number of organisations that already collect that kind of feedback. So you've got NHS Choices, Patient Opinion, and what CQC are planning to do is to take that information from those sources and actually put it on the website, on the CQC website, so that people can look up a provider and see what the feedback has been. Hugely valuable, tells you a lot about how a service is doing, and it's something we need to do more of. So easy answer to the question, yes, CQC will definitely be submitting evidence to the Health Select Committee. It's a really important area, just as how a trust responds to complaints from patients about something that might have happened. They've also got to be responsive to staff who have concerns, and I think we've seen many examples of where staff feel unable to raise concerns. That's really a disaster for patient safety. You've got to have a culture in an organisation where staff feel safe and confident in raising any concerns about care that they might have. So it's a really important part of the work CQC are planning to do, and we've got to get it right. Okay, thanks very much for your questions. Some really good questions. I hope that we'll get the chance to answer some more again. In the meantime, follow CQC on Twitter, follow me on Twitter, and find out more about CQC by looking at the website.